Hey there guys, welcome to today's episode. We're going to be reviewing a video about dentistry by Dr. Sola and Dr. Naz that I believe are still dental students at the moment. I might be wrong, they might have graduated by now. They're in the UK system. The title of their video is Do Not Study Dentistry, like the truth around it. And here's my response as a dental student as to how much of that I agree with and how much of that I disagree with. So let's get into it.
We are going to be getting really honest into this video and be exposing things they don't really tell you.
The vast majority of people think that dentistry is a very easy career, it pays very high, and it's just like once you get out you'll be paid 100k, but this is not the case. So today we're going to be telling you why you should not study dentistry.
Okay, so pretty strong introduction there, right? It's the typical things that we believe when we are planning to do dentistry as students. It's going to be great. You're going to be rich by, your first year, as they've mentioned just there. And then the disclaimer, like, it's not what you think. So let's get into the video. Let's see what else they have to say.
Particularly easy either. So the average starting salary for a dentist in the UK is 32,700. This can vary a little bit, but that's basically what everyone earns on their first year of training. This seems quite a lot for a starting salary, but once you take away national insurance, income tax, student finance, this goes from 2,700 to 1,700 a month, which isn't that much when you think about it. What we say is that we really don't recommend you do dentistry if you're doing it solely for money, because there are courses that pay a lot higher for a lot less stress that you could do if you want.
Anyone who knows my channel is going to know that I am very open and honest when I say I'm doing dentistry for the money, right? That's probably the only person you're going to find online that says that. But if you've got the drive enough to go to dental school, then you probably have drive enough to do a lot more for yourself as well. So they've kind of told you the bad part first year, but after that it really does go in the right direction. So there's also the aspect of running your own clinic or clinics. There's a business side of dentistry which is not really spoken of much. You'll probably find that information online somewhere, but just being a dentist isn't the be all and end all of it. You can be a practice owner, you can then run chains, you can then really bring this out into your own brand and develop dentistry in a way that you see it fit, and that could really bring in the cake. So the money aspect of it, disagree with them. And take it from me, there's a lot to be made in the world of dentistry.
Another misconception is that dentistry is easier than medical school. So it's definitely not easier. We have lots of assignments, exams, deadlines to complete, just like any other course really. Our first year is basically just like medics, right? Yeah, so we've got a lot of content-based modules, a lot of exams, ICAs. We also learn about anatomy and diseases and all the various diseases of the body, because obviously they all relate to the mouth and the oral cavity. For instance, if you've got a heart problem, this could be related to any infection into your gums. So it's very important to know about the human body and all the anatomy.
When we were in year one, we were learning about so many different diseases. I was just like, how does this actually relate to dentistry? Like, I just felt like I didn't sign up to do medicine, so why are we doing medicine? But in actual fact, everything does relate back to dentistry, and it is important that we learn this stuff.
Another important point.
Okay, so is dentistry easier than medicine? Is dentistry harder than medicine? They're saying that dentistry is harder than medicine, I guess, is what I'm taking from this. And yeah, dentistry and medicine are pretty much the same courses for the first couple of years, which is why we call them the pre-clinical years. You're going to learn a lot of medical related terms, terminologies, the human anatomy, all the rest of it. Now, dentistry, in my opinion, from the experience that I've had, it's like starts super hard and then tails off, and then it just becomes routine, because you are then in your clinical years, i.e. maybe your third, fourth, fifth, or your fourth, fifth, sixth years, depending on which university you're going to. You're pretty much just focusing on dentistry. You get 3 whole years of doing that in most cases in your clinical years. In medicine, however, every rotation is different. Medicine is ridiculously hard. The amount of work that they have to put in, the amount of graft, and really if you were to compare the two, you have to study a lot more if you're doing medicine than you do for dentistry.
Space is available, more competition, it's harder to find work experience as well. In terms of procedures, it's very technique sensitive.
Okay, so there's less seats. Yep. There is less seats. There's more competition? No, it's proportionate. There are fewer people that are applying for dentistry because it's not one of those career paths that people really think about when they want to get into the medical profession. Usually being a doctor, a surgeon, or anything along that line is something that people are more looking forward to doing. But I believe that it's harder in terms of your A-level grades to get in for medicine than it is for dentistry.
Various procedures that you will be performing, you need a lot of practice and it can get quite stressful as well.
And you could easily mess up, and once you mess up to like a very serious point, you have to extract the tooth. So it can be very, very stressful.
It can get quite tedious as well.
Yes, any procedure you get wrong, it can really stress you out, believe me. But it's a tooth, right? So let's just imagine that in the case that they're explaining that you mess something up and you have to extract a tooth. You're extracting a tooth, right? You're not going to kill the person. I get it. I get they're trying to highlight the negative points of dentistry, but if you're comparing it to medicine, I would say having someone's mouth in my hand and that at risk compared to someone's life, there's a huge, huge difference between the two.
So in dental school, to test our clinical skills, we have something called gateways. So these are time-sensitive exams whereby we have various elements that we have to pass in order to move on to the next year.
Gateways, probably assignments, courseworks, assessments, whatever you want to call them. That's pretty much with everything. You have to pass your exams and your assessments during any course that you do at university to get on to the next stage. So making that a sticking point, again, maybe they're just trying to scare you away from dentistry, but that's just part of uni.
So I do get some comments on my TikTok videos asking me if we even have exams, because obviously we are glamorizing dental school so much. We have to bear in mind that that's just the funnest parts of dental school. Those are the best parts that we record.
Like the highlight.
Yeah, the highlights of our day. And even the time that we even get the time to take out our phone and like record something. So we definitely do have exams. It's not all that fun and we do get stressful situations, and since we are so ambitious with dental school, we try to make it look as fun as possible and record the best parts that we truly enjoy.
But it's not like completely realistic. You do have to...
That is so true. Again, this is kind of like the first point about glamorizing dentistry, for sure. I'd say about 10% of our dental courses as students is about 100% of what you see online. Keeping all of your different subjects in check and being on top of all of your work, you're not going to see that. But then again, you're not going to see that with anyone who's doing a vlog. They're not going to sit there and bore you to death with them sitting in the library just studying all day.
Bear in mind that we do have stresses behind the video, so yeah. It's not as glamorous as it seems.
So overall, dental school is quite challenging, but it was definitely very rewarding, and seeing your patients smile will really make your day.
So another reason why you shouldn't study dentistry is because of this misconception that a lot of people have. A lot of people think that dentists have a very easy work life. Typically, dentists work 9 to 5s with weekends off. It is a good work-life balance. You can have a family, you can enjoy yourself. But this is not the case for everyone. Although it does have a better work-life balance than medicine, this does not necessarily mean that it's easier. Often you might have to work later than 5, you might have to work on weekends, you might have to be on call, so it's not as clear-cut as it seems. And people often view dentists as money grabbers, that they just want to do procedures quickly. So
Not going to agree with that one, right? As dentists, in most cases, you're working as a self-employed individual, right? In essence, you're always going to be self-employed. You therefore then have the right and the power and the sway during your contractual negotiation to say, hey man, I'm working 9 to 5 and that's it. The amount of negotiation power that the dentist has in comparison to the medic, you cannot compare the two, which is why doctors are constantly going on strike and junior doctors aren't even working in the NHS at the moment. Furthermore, when we look at the work-life balance of a dentist, it is 9 to 5, but everyone's work is 9 to 5 in essence. You know, you're not in a position where you're dealing with dying patients or people that are ill, or that stress does not carry over with you when you go home at night. That's pretty much left at the door, you come home, you enjoy the rest of your evening. I think the work-life balance is really good in dentistry, and I think that the salary that you get for it as well means you can really enjoy your life outside of work.
People often view dentists as money grabbers, that they just want to do procedures quickly so that they can get more money, but this is not the case. Most of the time, the dentist really does care about you. They want to do what's best for your interest.
Yes, I definitely agree to the point that Sola just made. It's not just about grabbing money, it's definitely about help to relieve their pains and really give them their smile back.
A lot of the procedures in dentistry do take a toll on your body. For example, your back, your shoulders, your hands, because they do require a lot of precision, a lot of working in small places.
Yes, have to agree, cannot disagree with that. Your back's going to take an absolute caning being a dentist.
So there's often a pressure to see a lot of patients in one day, back to back. So this often means that you'll finish late or you'll miss lunch, which is just really inconvenient sometimes.
Those pressures are again in your hand. If you are bad at negotiating your contract with your practice owner, that's on you in the nicest way possible. The only other instance in which this could happen is if you're new to dentistry and you are slow with your procedures, and they're quite good with time management as well. I don't know of any dentists, I know quite a few actually, that are in the game for so long that have issues with time. I don't think anyone does.
Overall, dentistry is not as easy as people think. It is quite difficult, it is quite demanding, but overall it is a very rewarding career, as we've said before. Like seeing the smile on your patients' faces after you're done, it just shows that your hard work pays off.
Another important point is that dentistry can get emotionally draining as well, because we've got anxious patients, difficult patients, really a variety of different patients that we have to deal with, and we have to make sure to please everyone.
So emotionally draining because of your patients having anxiety and all the rest of it. Well, this is a career that we chose before we went to university, right? And we knew at that point that it is a patient-facing, customer-facing, client-facing profession. If you don't have that naturally, you probably aren't even thinking about doing dentistry anyway, because it is such an intimate, close position to your patient.
And there's also potential to get sued if things go wrong. So this isn't particularly common, but it is something that you have to be aware of. So it's very important to have an insurance company to back you when things like this happen.
Like dental protection.
Yeah, there are a lot of people out there in dentistry now, a lot of patients that just want to sue. So having indemnity, having insurance and all the rest of it, it's part and parcel of being a dentist. But again, the amount that you're going to put towards it, it's going to be like a fraction of what you'll be getting out of it, and the protection that you'll be getting as well is well worth it anyway. It's just like driving around a car, a nice car with insurance. It's going to cost you a bit, but you'll get that peace of mind.
So it can also get quite tiring to treat a lot of patients under pressure. So it's time pressure, work pressure, and also the fact that you really want to do well, and that perfectionist in you really wants to make sure you get the best treatment, you keep the patient happy, and you perform really your best work.
Just building on to what Nazanin said, that sense of perfectionism, it can really damage your self-esteem, especially when you look at social media, when you see all of these before and afters, all of these restorations. You start to question your own skill and think that you're not good enough, that your restorations are not good enough. So ultimately, you just have to focus on yourself and focus on your own progress. So
emotionally draining more on your own skill set, which I've mentioned now, that makes more sense. So if you are a perfectionist, then yeah, you're probably going to sit there and say, oh, did I do that right? Did I do that wrong? And I might compare it with this other super well-known cosmetic dentist that does their teeth so well, yada yada. My advice, you're being an idiot, right? Don't do that. Like at the end of the day, if you're focusing on perfectionism, you're going to spend hours and hours, over the top amounts of time on getting certain simple procedures done, which is actually going to put your patient off. They're going to be sitting there saying, I don't want to be in this chair for that long. I don't want to be sat here paying X amount for you to take 2 or 3 hours of my time. It's not worth it for me. It's completely different if you are a cosmetic dentist that prides themselves on perfection and that you're good enough in the first place, that people are paying that premium to come to you anyway. That's a completely different story. But for the average dentist out there, it's not about perfectionism. This is a mindset change that needs to occur that allows you to push yourself more on being an efficient dentist than a perfect dentist.
So overall, this video has been very negative. It does seem like we're trying to put you off dentistry, but that is not the case. We did say this video was going to be realistic, and we did tell you we're going to tell the truth. So here are the reasons why you should actually study dentistry.
Let's go. So although it is hard, it's quite time consuming, obviously it's a lot of years of study, but if you have done the work experience, you've looked into it and you think this career is for you, then why not? Definitely go for it, you can do it.
The main requirement for dental school and dentistry as a whole is time management and networking. There are many dentists who are happy with their work-life balance. They can spend time with their family, go on holidays, enjoy themselves.
Over here, they've just said if the main reason that you should do dentistry is because if you've done work experience and if you like it, you should go for it. from my opinion on this, don't do dentistry because I went to work experience and I liked it. Don't do it based on that. Do it based on a lot of interactions with dentists. Ask them how their work-life balance is. Ask students that are currently at university. Ask everything. Just keep asking questions. So really the first question you need to ask yourself is, what do I want in life? Non-mentally taxing job that allows you to leave your worries at the door, clock in, clock out, and just have a good time at work with a great team around you. So from me, that's the end of this reaction video. I hope you enjoyed it. If you have any questions, feel free to run them by me. Of course, get in touch with the girls as well. I don't know whether they'll ever see this video or not, but it's open to all. So I hope you enjoyed it, and I will see you on the next one. Take care. Bye bye.